Hello, I'm Matthew Weinstock, Managing Editor for Modern Healthcare. Thank you for tuning in to the latest edition of The Checkup. Throughout the pandemic, one of the key issues for industry leaders has been coordinating closely with state and local government agencies. I'm pleased to be joined today by Hartford HealthCare CEO Jeffrey Flaks, who has served on the state of Connecticut's response task force to talk about some of those coordination efforts, some of the lessons learned of working with state and local governments, as well as some of Hartford's own work in expanding testing. Jeff, thanks so much for being with us today.
My pleasure.
So let's start with that idea of working with state and local governments. I know you've been very involved in the efforts in Connecticut. You were on the governor's task force. Talk a little bit about what that process was and has been like and some of the key lessons learned.
It's been really important to your point, Matthew. In our state, we've worked hand in hand in terms of the healthcare delivery systems and the state government. From day one, our governor, Ned Lamont, reached out. He appointed me, Marta Borgstrom, the CEO of the New Haven Health System, and John Murphy, the CEO of the Nuvance Health System, to collectively chair and lead the state preparedness and response efforts. And we spoke daily with the state leadership, with the governor personally. We still speak several times a week through a structured phone call process. And to me, it's been about being pragmatic. It's about being responsive where necessary and progressive in the sense of looking forward and identifying where we think things will be and how we should plan and prepare for those measures that we can anticipate.
Were there things as you went through that process that, as we look towards a second surge that you would do differently in working with the governor?
Yeah, it's a really interesting question. And as I've thought a lot about it, when I look at how we've responded within Hartford Healthcare, and we've been so fortunate in Connecticut, by and large, with the way we've been able to manage through this crisis. At the time we made the decisions, with the facts that were present at that moment, I really look back and I think we made the right decisions. With the benefit of hindsight, if we had known that certain things within PPE would free up the way they did, or certain medications might become more available at a certain point in time, we might have made decisions slightly differently. But really, when you're in the crisis, one of the important things is you have to have agility, you have to be decisive, and you have to make the best decision in the moment with the best information you have available to you.
You referenced the other health systems that were part of that task force with you. What has that collaboration been like? And really looking forward, Jeff, what do you think that's going to mean for the delivery systems going forward?
Yeah, I think it's terrific. I think it was incredibly important during this crisis, and I think it's important really at all times. I said throughout this crisis, we don't wear any uniforms. We have one uniform. It's the state of Connecticut. It's doing what's best to protect our community, to protect our colleagues who work in healthcare. And we need to collaborate, coordinate, and just do the right thing. And it really held true. And my peers, Marna and John, and our leaders in the state government, really just, I think, led with their values throughout this process. But to your broader point, Matthew, when you think going forward, when matters of public policy, matters of health equity and disparities, matters of trying to create more innovation, viewing healthcare really as the economic driver that it is, coordination, alignment amongst regional health systems is absolutely critical. And I hope it's one of the things that comes out of this. I've said, Matthew, many times, I've said, look, we don't want to return to normal in healthcare. We're going to be better than normal. This would be one of those examples.
So let's stay on that not returning to normal as you think about collaboration with your competitors, right? Are there areas where you could see 1 to 2 years down the road where you put aside the competitive environment and you're starting to collaborate more?
Sure. I think there are examples. I think there's a lot of examples from a community health standpoint, health equity perspective, certain programs where it's more efficient, more logical that we should coordinate and work together. So I think we have to remain very open-minded, have to look for opportunities to do so. At the end of the day, our job is about community. It's about access. It's about quality, and it's about affordability. So when our collaborations can result in those benefits, we absolutely should pursue them.
Got it. Jeff, one of the other areas I know you've been working on is expanding testing throughout the state. both through your market, but also, I believe, working with some of the public health agencies and Department of Corrections, nursing homes. Talk a little bit about what you've been doing there and how that's been rolled out.
We created, Matthew, a testing company in this process. We have about 160 people who are working full-time. We have 9 full-time drive-through testing centers that are set up throughout the state of Connecticut. But we also have 5 mobile units that we deploy every day. It's one of the areas I'm most proud of because I think it's one of the things we've done that makes the greatest difference. So our mobile centers go to homeless shelters, they go to prisons, they go to nursing homes, they go to state agencies, they go to first responders, they go to all critical services, and they go to populations who are most vulnerable. And we do testing very broadly. We're doing 2,500 to 3,000 tests a day within Hartford HealthCare across the state. And we're operating 7 days a week, and we're with really significantly extended hours. And, as we think about how we contain this virus, testing is absolutely critical. I also would point out we created another new company, HHC Campus Cares. And HHC Campus Cares is now managing student health and population health on the majority of the college and university campuses throughout Connecticut. And we've integrated the HHC testing company's efforts into HHC Campus Cares so that when you think about areas where we have great vulnerability, but that are also essential to our region and to our local economy, like our colleges and universities, we're able to deploy our resources there to try to maintain their operations and allow those schools to continue to do what they're supposed to do.
Interesting. I want to touch on that, but back to the testing. How have you funded that testing platform, that company, and how are you sustaining it?
So for a large portion of the pandemic early on, we operated at a loss. And, my point of view on this has been really from the beginning of this crisis. This is a historic moment. It's why we're here. We were built for this. It's why we exist. We're not going to allow the economic decisions on the front end to really limit the ability to respond and do what's right for the community. So when we stood this company up, we were doing testing for months, really where we had limited payment streams. More recently, we've structured agreements with large companies, with colleges and universities. We have agreements with the state in different ways. But generally speaking, it's not by any means an area of profit. I really consider it to be just an essential part of how to maintain services for our state and how to create the ability for people to function a more traditional daily life than they otherwise would.
Got it. And have you had problems with supplies for testing? We've heard from other folks that, reagents, for example, have been a real struggle for them.
Well, so we've been very fortunate. About 5 years ago, we created a national partnership with Quest Diagnostics. We actually sold Quest, our company, which was then known as Clinical Lab Partners, and we integrated through this partnership, a special, unique partnership with Quest. And I have to give Quest great recognition. Steve Ruskowski, who's the CEO of Quest, came here to Connecticut early in this crisis, made commitments around our partnership, and really gave us the capacity to test thousands of people through Hartford HealthCare every single day. And throughout this process, they've been reliable. And they're under great distress, obviously, as there's different dynamics that occur in different parts of the country. But by and large, they've really been able to support us. And it proved their scale, their expertise proved to be a great aligned partner during this crisis.
Got it. Jeff, real quick on the university piece of it, we're hearing more and more universities that are dialing back in person, going to remote. So many outbreaks from college campuses. What's been the experience of the universities you're working with there in Connecticut?
It's been a really, look, it's a tough issue. We've been very fortunate. And I give our college presidents and university presidents great recognition. It shows a lot of courage in many ways for them to stand up their operations, to try to put measures in place to maintain campus environments. But so far, we've been very fortunate. We do testing. We have isolation in place. We have mechanisms to treat people in these circumstances. And the schools that we've aligned and partnered with, I think, have done a very good job. And we consider it a really critical part in Connecticut of maintaining some sense of normalcy during this time period.
Got it. One of the areas, obviously, that Connecticut's been hit hard on is the nursing home front. I know you've been doing some testing and reaching out to them.
Right.
There's also been, some concerns about the outbreak at Bacchus Hospital, which is a Hartford hospital. What are you doing to address those concerns, and how are you beginning to think about, patient and worker safety as some of those outbreaks have come along?
Our safety for our patients and for the people who work within our system, it's paramount. It's from the very first moment of this crisis. It's been what's most important to us. We've done everything humanly possible during very unprecedented and ambiguous times to do everything we can. We have recently had a circumstance where several of our colleagues in one of our hospitals did get COVID-19. And, it shows how perilous this is. And it really shows why precautions and protections from wearing a mask, proper hand hygiene, all of the use of personal protective equipment, social distancing, and the discipline around this is so critical. And we recognize within our nursing homes that we work with and partner within our communities. I mean, they're under very difficult circumstances, and there's great vulnerabilities in those nursing homes. So we have to, by all means, bring testing to those nursing homes, and wherever possible, support them as they work hard to protect all people involved in their communities.
Are there some key operational changes that you're going to start to roll out, though, based on what's happened both at your hospital and across the nursing homes in the state?
Well, we're working just to continue to reinforce our policies. When in any organization around the country, the vulnerability exists all the time. I mean, during this COVID-19 crisis, it takes one lapse in judgment, one momentary break in practice, and exposures can happen, and they do happen. But we have to do everything we can to create good systems, good measures in place to try to do everything we can to prevent those things from occurring.
Okay. Jeff, I want to shift lastly here to, we're moving into flu season. There's question about the COVID vaccine and when that's going to come. And obviously there's a skeptical public based on some of the politics that are behind this. Can you just talk about how Hartford is talking to your patient population, both about flu, but also about the broader issue of vaccination and the importance of a COVID vaccine when one does come out?
Certainly. So Matthew, we're making substantial investments around the flu vaccine, and we're going to convert our entire testing apparatus. So our existing 9 drive-through centers, as well as our 5 mobile centers, to actually start doing distribution and vaccination for flu. So we're launching a very significant effort. We're also launching a tremendous public campaign around awareness and importance of flu vaccine. And we have 400 plus locations across Connecticut, and we're using all of our locations now to create access and distribution points for flu. At the same point, though, we're looking forward. And when a vaccine is approved and when there's broad distribution, we are creating mechanisms within our system, because we've learned so much in this crisis, and we've created wonderful delivery points that we believe the very same mechanisms that we're using now to successfully distribute testing, we can use that same mechanism to distribute the vaccine. And we're working with the Department of Public Health. We're proposing some approaches that we would take that could allow us to do that. So I'm hopeful that when that moment comes, and it can't come certainly soon enough, that we're going to be ready and prepared for our community to do everything that's necessary to make it as available and as accessible as possible.
So that availability, accessibility is the one piece. Obviously, getting the message out is another. We're even hearing from some folks on flu saying, well, I'm going to be at home, quarantine, masking, I don't need to get a flu shot. Again, how do you start to communicate to your patients that, no, you really do need to come in and get this?
Yeah, so we're using massive messaging. We've got tremendous platforms. Throughout this crisis, we send communications to our 750,000 patient base routinely, more so than ever before. It's one of the things I hope never goes back to normal, because we're more connected with our patients than ever before. Our social media platforms, have risen in prominence and reach. We're partnering with all of our broadcast partners and our print media. So we have a massive campaign because, it's not about whether they get the vaccine with us, and we will be a significant partner in that way, but it's that they get it. and the convergence of the flu season and COVID-19 still existing within our community, it's a critical juncture for us. And we believe we have a responsibility from a public health standpoint to use all of our capabilities and resources to reach the public in this message. And we're going to be on air. We're going to have our physicians, our caregivers, infectious disease physicians omnipresent on delivering this message, and we're going to monitor it very closely.
Great. And lastly, Jeff, will you mandate that your staff get the COVID-19 vaccine when it comes out?
So we haven't addressed that yet. We do mandate today the flu vaccine, with a certain exception, but we will work through that, I'm certain, in the near term. And we're working hard to make sure that it gets here and that it could be administered safely. And when that day comes, we're gonna stand forward, and we think our system has an obligation and responsibility to be a driver of making it available within the public.
Is the staff piece, though, something you have to work out with some of the unions and some contract language, or is it a broader conversation you need to have?
No, it's something that because it doesn't exist yet today. We haven't taken a formal position, but I'm certain we will soon. And I don't think it'll be terribly different than like circumstances with the flu vaccine, which we've addressed for years now. Got it.
Well, Jeff, I know it's a busy time. We appreciate you taking some minutes with us today on the checkup. We'd love to check back in with you as things unfold up there in Connecticut.
Oh, Matthew, my pleasure, and appreciate the opportunity to speak with you today.
Thanks so much, and stay safe.
Thank you. You too.
And I'm Matthew Weinstock with Modern Healthcare. Be sure to check back in next Monday for another edition of the checkup. Thank you.